Hello everyone, welcome to study Ayurveda. Today we are going to study about the kasa. Let us have a look at the nirukti of kasa. Kasanat kasaha. So the one which produces kas-like sound is called as kasa. And kasa is one of the reflex. Kasati shiraha kantat urdvam grahati vayu iti kasaha. So the vayu which is expelled from the srotasus of the sira through kanta and swarayantra producing kas-like sound is called as kasa. Shushko va sa kafo va api kasanat kasah uchyate. Here, the kaf either it may be shushka here is dry, sa kafa here is mucoid. The kaf either it may be shushka or along with the kafa it is called as kasa. Let us have a look at the nidhana of this kasa. धूमोपघातात् रजस्तथैव व्यायामवृक्षान्ननिषेवनाश्च विमार्गगत्वाच्च हि भोजनस्य वेगावरोधात् क्षयतुस्तथैव. Dhumopaghatat here is excessive exposure to the fumes or smoke. The person who is working in the industries has more tendency to develop these kind of diseases. Next we are having Rajastataiva, excessive exposure to the dust. The person who is traveling on a regular basis and the person who is riding bike daily for their work and the person who is living in the metropolitan cities. Vyayama, excessive physical exertion is also one of the reason for the manifestation of this kasa. Rukshanna nishevanascha. Rukshana nishevanascha here is the excessive intake of dry food items or consumption of the food which is very dry for the body. Vimargagatvacha hi bhojanasya. Here there will be the here vimargagamana means that the reverse direction of flow of food which is taken by the person. We can say here that the regurgitation of the food is also one of the condition which we need to remember. And the second one is if the food rather than entering into the esophagus it enters into the trachea, then it will produce the cough reflex. So these two conditions that we need to remember. And the third one also we can say some people by the intake of food sometimes if they are talking or if they are laughing while taking the food it enters into the nose also. So it is also vimargagatva hi bhojanasya. So in these three conditions that we remember that vimargagatva cha hi bhojanasya. Next, vegavarodhat kshvaitustataiva. Vegavarodhat kshvaitustataiva here is doing the vegadharana of kshvaitu. Some people are very shy in nature. Even though they get the sneezing reflex, they will not sneeze because they try not to get attention from the surroundings, so that's why they will not sneeze. So it is also one of the main condition where it is responsible for further manifestation of the disease kasa. Let us have a look at the some property of this kasa. Prano hi udananugataha pradushtaha sabhinnakamsya swanatulyakoshaha निरेति वक्त्रात् सहसा सदोषो मनीषिभिः कास इति प्रतिष्ठाः. First one is प्राणो ह्य उदानानुगतः प्रदुष्टाः. Here prana and udana vayu pradushta. How this pradushta of prana and udana vayu occurs? Because of the vimargagamana of vata. Vimargagamana of vata occurs here, that is mainly prana and udana vayu. Okay, sa bhinna kamsya swanatulya ghoshaha. Here because this pradushtita or vimargata of vayu, vimargagamana of prana and udana vayu, it enters into the uraha pradesha and it makes it to, because of its vimargagamana, it is moved towards the shira and rudhaya. Okay, this prakupita vata produces bhinna kamsya swanatulya ghoshaha. Here the sound, the mouth is producing the sound which is resembling that of broken bell made up of bronze metal. Kamse here is the bronze metal, so it makes the sound similar to that of broken bell made up of bronze metal. Okay. Nireti Vaktrat. So, this type of sound is produced by the mouth. Sahasa, Sadosho Manishibhi Kasa iti Pratishtaha. Here, Sahasa word is taken because the Prakupita Vata produces bending, stretching of the body, jaws, and sides of neck as well as eyes. So, again, it leads to contraction and stiffness of eyes, back, chest, and sides of chest. So, it makes the body to move forward or bend forward. So it is associated with severe pain. Okay, because it is associated with severe pain exertion to the patient, so that's why it has named as Sahasa. Sadosho Manishibihi Kasa iti Pradishtaha. Sadosho Manishibihi here is mainly the kasa is of different types. So based on its dosha, the kasa is manifested in different ways. Let us look at the Purva Rupa. पूर्वरूपं भवेत्तेषां शुकपूर्णगलास्यत कण्ठे कण्ठे कण्डुश्च भोजानम् अवरोधश्च जायते शूकपूर्णगलास्यत. Here is the dryness of throat, irritation as if thorns are present in the throat, or it feels like there is something which is pricking in the throat, and dryness of the oral cavity is there. Okay. Kante kandushcha, irritation in the throat or itching sensation in the throat. Okay. Bhojanam avarodhascha jayate, there is obstruction for the food passage during swallowing. So these are the Purva Rupa for the manifestation of Kasa. Kasa Bheda. Panchakasaha Smruta Vatapitta Slekshma Kshatakshayaihi Kshayayopekshitaha Sarve Balinascha Uttarottaram. There are mainly 5 types. Those are Vatajakasa, Pittajakasa, Kafajakasa, Kshatajakasa, Kshayajakasa. Many people have the confusion regarding which type of kasa it is or which type of disease it is, how to differentiate between Vata, Pitta, Kapha, Kshataja and Shayaja. So, main things that we need to concentrate when the patient is in front of us. So, what are the questions that you need to ask, and what, depending on his answers and depending on the lakshanas or depending on the symptoms and also depending on the sputum, how it is, based on that we are advising the patient the correct line of treatment, and also we are giving the patient correct line of treatment and also advising the patient to follow some of the patya and apatya. So that is important to remember. And what are the things which is really important to understand is, first one is nidhana, second one is lakshana, third one is kapha, that is sputum, and fourth one is upashaya. Upashaya, what we are advising the patient to follow in those conditions. In Ayurveda, we are having and we are deciding the medicines based on the Vata, Pitta and Kapha, and based on these doshas only we are advising the patients to use the medicines along with different anupanas based on their prakriti, based on the dosha which is present in that vyadhi. It is very much important for the diagnosis. So how to diagnose and what are the things that need to be asked to the patient is, first one is, let's see about the Vataja. Okay, so in case of Vataja Kasa, the nidhana here is mainly Vruksha, Shita, Kashaya, Alpa Bhojana. Here the food items which are very dry is used by the person. Shita, very cold type of food items are used by the person on a regular basis. Kashaya, rasatmaka dravyas are used by the patient, like we can consider here the betel. Next is that alpa, the person is having the habit of intake of very less quantity of food. Pramitashana, here is the person used to take the food which is of only 1 or 2 rasas, so that is called as pramitashana. Like the person is having habit of taking of only the food which is sweet in nature, or sweet Madhura Rasatmaka foods are taken by the patient, or Amla Rasatmaka foods are taken by the patient, or Ushna Gunatmaka foods are taken by the patient on an excessive basis and regularly also. That is important to remember. Stri and Vegadharana, ayasa. So these are the nidhanas which are responsible for the manifestation of vataja kasa. So let's see about the lakshanas of this vataja kasa. How we can differentiate is Rutpashva Shirashula. The patient comes to your clinic by explaining the complaints of pain in the heart, pain in the flanks, as well as pain in the head. He explains like that. Shushkata. Shushkata here is the mainly dryness is present in the chest and also in the throat region and also in the mouth. He explains about the dryness in the mouth, throat and chest. Okay. Prathamya here is because of continuous and loud bouts of coughing, he experiences blackness. Daurbalyam, there is a loss of strength. Kshobha here is mainly the person is having excessive distress. The person is completely fed up with the condition by repeated coughing and he coughs repeatedly but the sputum is not coming out. If the sputum is coming also, it will be very dried, and because of that he gets exertion, he gets distressed. Moha, just because of repeated episodes of this coughing, he becomes moha. Here is he gets into the state of confusion. Third one is the kapha or sputum. How the nature of the sputum is here. Shushka kasa, here mainly there will be no expectorations are present, only dry cough is present. Shushka kapha, even though the expectorations or even though the mucus coming out, it will be very much in small quantity and also it is very dried in nature. Okay, kruchra. Kruchra here is if the cough is there, it is with very less sputum due to forcible coughing or after a long stressful coughing. The person tries to cough for a longer duration and also after a long stressful coughing, the person is getting a small or less quantity of expectoration. Okay, next is upashaya. So we are advising the patient to use snigdha, amla, lavana and ushna gunatmaka dravya. Next, have a look at the pittaja. Main first nidhana here is katu ushna vidahi amla and kshara. By the intake of the food which is rich in katu ushna vidahi amla and kshara gunatmaka dravyas will leads to the manifestation of pittaja kasa. Let's see about the lakshanas of pittaja kasa. Those are mainly urodhumayanam. The person explains you that there will be a hot burning fumes are emitting from the chest. He feels like that. The hot burning fumes are emitting from the chest. Okay. Next, Trishna. Trishna here is there will be excessive thirst. Daha, burning sensation. Moha, confusion. Aruchi, the person has the anorexia. Brahma, the person suffers from the giddiness. Okay. Jyotim Shiva here is after strong bouts of coughing, the patient perceives spark in front of eyes. He explains you that after many strong bouts of coughing, I am getting spark in front of my eyes. So he explains the complaint like that. So on that note, you have to consider it as a pitta type of kasa and go for the management according to that. Tiktaseta. Tiktaseta here is a bitterness of mouth is present. Swaramaya. Swaramaya is hoarseness of voice is there. What is the type of sputum or what is the characteristics of sputum here? They have given here that Pita Nishtiva means the productive cough with medium bouts. As compared to the Vataja, it is having cough is present with the cough is productive nature with medium bouts are present. Okay, Slekshma Pitta Samstrushta Nishtiva. Because of the Pitta, a small amount of Slekshma is also evacuated by the cough. So it is mucoid in nature but produces burning sensation in the throat, mouth and the chest region while expectoration. Okay, next upashaya for this is mainly Shita Tikta and Kashaya Rasatmaka Dravyas. Also, Madhur Rasatmaka Dravyas are advised for the patient to take on a regular basis. Next we are having the third one as the kafaja type of kasa. In kafaja kasa, the nidhana here is guru, abhishandi, madura snigdha and swapna vicheshtana. The intake of food which are guru in nature, which are abhishandi, which are madura and snigdha gunatmaka are taken by the patient on an excessive basis. Swapna vicheshtana here is sleeping at improper time is considered as one of a nidhana. Sleeping late night and sleeping in the day is considered as a swapna vicheshtana. Okay, what are the lakshanas? Let's see. Mandagni, there will be a hampered agni is there. Aruchi, tastelessness is present. Charti, there will be repeated episodes of vomiting. Pinasa, there will be excessive nasal discharge is also present. Utklesha, Utkleshashcha here because of vomiting. There will be vomiting sensation is also present and vomiting is also there. Utklesha here is the sense of nausea is there. Nauseation is present in that person. Gauravam, heaviness of the body. Lomaharsha, horripilations. Madhurasyata, there will be sweetness in the mouth. Kleda here is there will be increased moistness of the body or excessive sweating is there in that person. Sadhana here is person is not having interest to do any kind of work or their daily routine activities also. The characteristics of the sputum here is bahala. It will be very excess in quantity. Madura. So it is on the basis of hypothesis. We are not going to check whether it is a madura or any other taste. Snigdha. It is very mucoid in nature. Remember that bahala and ghana. Bahala here it is in the excessive quantity. Ghana here is it is a solidified, and it is in more, the bouts of mucus is in a much more quantity. Okay, that we can say. Ghana here is a solidified, we can say here. Ghana as a solidified, bahula as in excessive quantity. So what are the upashaya which is useful to reduce the kafaja kasa here is by the intake of ruksha, katu, tikta, kashaya, dravyas. So we need to remember here it is very much important to differentiate between vata pitta and kafaja kasa, because if it is a vataja kasa, you are advising the patient with the kafaja kasa upashaya like ruksha, katu, tikta, kashaya. So then it will aggravate the condition further and it will not be managed by the physician. So to manage it properly, diagnosis is very much important. Based on the dosha, we are going to select the medicines. Okay. Next we are having Kshatrajakasa. Kshatrajakasa here mainly caused by any of the external injuries which is hampering the which is responsible for any of the external injuries which is responsible for the manifestation of this type of kasa. So in case of kat nidana as ativyavaya, bhara, adva, yuddha, ashva, gaja, vigrahihi. So the person is doing excessive indulgence in the intercourse, bhara, excessive use of heavy weightlifting. Okay, adva here is excessive walking, yuddha here is doing fight with the person who is stronger than him, ashva and gaja vigrahihi by traveling in the horse as well as in the elephant for a longer duration of time. So these all are things which are responsible for the Kshatraja kasa. Okay, what? Let us see about the lakshanas of Kshatraja kasa. Here, kantairuja, the pain in the throat. Virugnena uraha, there will be severe pain in the thorax region. Okay, suchibiriva, there will be pricking type of sensation in the thorax or in the chest region. Dukkha sparsha shula, intense and intolerable pain is present. Okay, which is very severe, tender and excruciating pain which is intense and intolerable in nature. Bheda pida abhitapina, here there will be increased in temperature at the localized joints and also there will be pain in the smaller joints. Okay. Jvara, the patient suffers from jvara. Shwasa, the patient also suffers from shwasa, trushna, asya, etc. Okay. Next we are having the sputum. The nature or characteristics of the sputum here is sashonitam, because the it is because of the external injuries which is hampering at the area of urus, that is chest region. The main characteristic feature of the sputum is it is mixed with the blood. Immediately when you are having the history of this blood mixed with the sputum, we have going for the Kshatraja type of kasa. Okay, the kujana here is mainly the person who is coughing with the Kshatraja kasa is having the sound similar to like that of the pigeon which is making sounds. Okay, what are the upashaya? Yeah, because of the Kshatraja kasa, mainly we are advising the patient to use laksharasa, guda, saktu, yavagu, etc. are given, which is useful for maintaining the body and having the nutritional supplements, like it will be supplying the body with all the essential requirements which are responsible for the wound healing and also for stopping the bleeding. Okay, next we are having Kshayaja Kasa. So, in case of Kshayaja Kasa, the Nidhana here is Vishama Asatmya Bhojana and also Ati Vyavaya Vega Nigraha. These are the conditions which are responsible for Kshayaja type of Kasa. The Nidhanas which are responsible for the Kshaya of the body, which makes the person Krusha, these all are these Nidhanas are considered here. So, the Lakshanas are mainly there will be Kshaya, there will be severe emaciation of the patient. Hrudayachutam. Hrudayachutam here is what are the conditions of the patient where you can see and realize and also make the diagnosis that it is a Kshayaja type of Kasa by seeing the Lakshanas. Those are Kshaya. The person is completely in the Kshaya Avastha, a person is completely emaciated or Krusha. Hrudayachutam. Here there will be severe pricking type of pain in the cardiac region. Durbala. Durbala here is he is totally lost his strength. Krusha. He is emaciated completely. Pani Pada Tala. Aslakshana here is mainly there will be dryness of the Pani and Pada, the dryness of palm and soles here, and also there will be pallorness of eyes is present, and the oiliness of the skin is lost and it will become dull and pallor. These are the condition, and also we are having that the main important thing here is the cough may be triggered by either the consumption of hot or by the consumption of cold elements, or all of the sudden the person has the cough which may be triggered by either the intake cold or hot items. It is important to remember. And jwara, and it is recurrent onsets of the nose running and the pain in the flanks and also tastelessness, loose stools, broken voice, excessive anger, excessive thinking. The person is having all these things, and the characteristics of this sputum here is durgandha. It is having the foul smell or foul odor. Harita, rakta, puyakapa. Harita rakta here is it may have greenish discoloration around that, or it may be along with the rakta, and puya it may be mixed with the pus, so it is important to remember. So what is the upashaya in this case is sarpiguda. This is a mainly a specific preparations which is explained by Charaka. Mamsarasa is also one of the best thing to be taken in case of Kshayaja Kasa. Sadhya of Kasa. इत्येष क्षयजकासः क्षीणानां देहनाशनः साध्यो. So this because of the Kshayajakasa is responsible for the kshinat of the body, kshinat of the dhatu and dehanashana, it is a sadhya. Okay. Sadhyo balavatam va. So if the person is in the balavata avastha, then it is considered as the sadhya. Okay. Syatyapyastevam chatotitam. Navau kadachit chikitse tamapi padagunanvitam. Padagunanvitau. Here, if the person is having the Kshataja kasa, if it is in Nava Avastha, then it is considered as Yapya. Staviranam Jarakasa Sarvo Yapya Prakirtitaha. If it is a Jaraja kasa, then it will be manageable only. Trin Purvan Sadayet Satyan Patye Yapyamstu Yapayet. Here, remaining three are Vataja, Pittaja, and Kafaja. They are sadhya in nature and they are managed by patya and apatya following.